I'm the CEO here at the House of the Good Shepherd. I'm one of 5 people on my executive team, and we're responsible for providing different services and supports to about 1,000 kids a year. Typically, we're known for serving kids with behavioral difficulties. That's our specialty, and working with them as well as their family unit. We try and keep families intact, but we also make sure that kids are making developmental gains, making sure that they're getting an education, making sure that their medical needs are being met, making sure that they have the basics, the food, clothing, shelter, and most importantly, friends and a social network. We want to make sure that these kids have everything that all the other kids have. We do serve a couple of kids with developmental or medical difficulties, but generally their behaviors are a result of mental illness or some kind of trauma that they've received as children throughout their lives. So some kids were born with a predisposition to have behavioral difficulties. Other kids were born like typical children, but because of life's events are now having behavioral difficulties as they act out in response to some of the things that had happened to them. Typically, kids come to our campus through the family court system. Generally speaking, these are kids that have either committed a juvenile offense, maybe their parents don't necessarily know how to address their behavioral problems, or these kids have been neglected or abused over time and can't be safe in the community as a result of their behaviors. So what gets you on a residential campus is usually when other things have been tried and we can't keep these kids successfully integrated in the community and keep them and the people around them safe. They come to us, basically we give them some structure, they learn how to manage their behaviors, they learn about the things that trigger those behaviors. That allows them to remediate some of the risk-taking behaviors, and then they're reintegrated into the community. More times than not, back with their families. We run what's referred to as an 853 school, our Tilton school. We have about half of the kids that go there are day services kids. These are kids that are bused. And so they come in, they are kids with behavioral difficulties oftentimes as well, emotional disturbances. And we teach them as though we were just like any other school. They range in age anywhere from 6, 7, 8 years old, all the way up to 18 or 19. It's essentially government funded. The Committee on Special Education decide that the child needs to come to our school, and we receive a rate that's determined by the State Department of Education. I can tell you that we budget our school on a deficit. So we have some excellent educators who dedicate their time. To them, this is a labor of love, and to some degree are willing to accept a lower wage to serve a population that they feel that they have a calling to serve. We employ about 400 people. The majority of them work right here in the Mohawk Valley. I would guess that the mean age of a staff person that works directly with kids is probably between 25 and 30. We equip them with a lot of training, a lot of guidance, a lot of technical support to do what they need to do. In that respect, we're a very young workforce. We have a large foster care program. In that foster care program, we have service teams. So you're going to have a clinician, you're going to have somebody who's like a caseworker. 80% of our work is really geared toward parents. And 20% of the work is geared toward kids. When you look at the totality of what we do, right, whether it's the 130 kids that we have in foster homes or the number of kids that we're serving in their homes, we talk about children's services as if they're services that are being delivered to kids. Oftentimes, it's around the environmental factors, whether it be the family, whether it be their neighborhood, whether it be their school, and those things sometimes have to adapt to that child. We never rest on our laurels. We're always trying to focus on what is the strategy that's going to make this child be successful. By and large, the strategy has to incorporate the people who are raising that child. It just makes sense. I can also tell you that when the Department of Social Services removes these children from their homes and places them into our foster homes, one of the first questions we get are, when am I going home? It's what they know, it's where they're from, and the bond between a parent and a child is seemingly unequivocal in these kids' lives. There are several moments in a week where we can see the lights turn on for a kid. I think the difficulty that we have and the difficulty of our industry is really being able to replicate and predict what a result would be. A lot of the results are child specific. A lot of them are significant gains in their lives, but may not necessarily be sufficient. So I think we bring a quality of life to them, we bring safety to them, and we bring a lot of opportunities to them. Unfortunately, the protracted results and any research you do are somewhat suspect on that. And so we're constantly trying to figure out what are the practices that work the best and how do we replicate those practices so that we can reinvest our efforts into things that work versus the things that we've discounted as to not working.